Hi everyone, now we're going to be looking at the range of motion that's available at the talocrural joint. Again, that's between the talus and the tibia, and the subtalar joint, which is underneath the talus. First of all, the talocrural joint, it moves into dorsiflexion and plantar flexion. In dorsiflexion, we get about 20 degrees of dorsiflexion, and you get a considerable amount more of plantar flexion. It's not demonstrated well in this model, but about 40 degrees of the movement pressing your foot down. If that's 0 in neutral, again 20, and then normally you'd come all the way down about 40 degrees. If you look at the subtalar joint has considerably less movement. Inversion is one of the movements. That's to bring your calcaneus inwards, or your whole foot, bringing it in. That would be such as raising the inner surface or arch of your foot. Then eversion, by the way, that has roughly 20 degrees. If you go into eversion, taking the calcaneus outwards, that would be flattening your arch down. This one would have quite a bit less. This is about 5, maybe 10 degrees of eversion. So not a lot of eversion, but that's dorsiflexion and plantar flexion at the talocrural joint, and inversion and eversion at the subtalar joint. Note that there are a lot of ligaments which stabilize, of course, this joint, these two joints as well. The ligaments coming off the distal end of the fibula, such as the anterior and posterior talofibular, as well as the calcaneofibular ligaments, they are going to stabilize and prevent the joint from rolling inwards, the lateral ligaments. This is a very common sprain that happens, and it's in fact the most common injury in the world is a sprained ankle. There are ligaments on the medial surface, collectively called the deltoid ligaments, but they are much less commonly sprained. Next video is on the toes and the movement between the tarsal bones.